Higher education institutions are currently immersed in a change of paradigm, wherein the fundamental values of equity and inclusion are guiding the diversity agenda. International education policy directs education systems towards promoting fair social practices and encourages higher education to be a space for harmonious coexistence that is accessible to everyone. Our aim is to understand how national legislation is institutionally developed within universities and how it is perceived by their major representatives in the fields of access, university life, and students' progress, teaching staff, and non-academic staff. This project is framed within a larger study whose general aim is to diagnose policies and practices in order to propose an institutionalization plan to address diversity in higher education. A qualitative approach is being used through political discourse analysis, which will be based on the analysis of data extracted from the institutional websites of the 10 public universities in Andalusia, and semi-structured interviews, which were recorded and transcribed literally for subsequent coding by means of the program Atlasti version 8.3. Results. The findings show that inclusive university policies in Spain are making progress with regard to disability, which explains the hopeful vision of their leaders. There are still obstacles that need to be surmounted. Students are the focal point of the discourse generated by policymakers and documents. There is a perception that equal opportunities are ensured. Integration has been achieved very well in middle education, and now we are making progress to transition that into higher education. There is a distinction drawn between the more normalized difficulties such as functional, visual, or auditory diversity, and other less common difficulties such as those related with cognitive, behavioral, or socialization aspects. The employability of students with disabilities is yet to be tackled rigorously. There is a lack of mechanisms that allow non-academic staff with disabilities to access such posts. For faculty and staff, there is a recognized lack of resources and there are difficulties in terms of offering a response to sensory disabilities. We are prepared for blind students, but not for blind teachers, and there have been some. Conclusion. Policies are focused on documents and discourses on students, but academic and non-academic staff are largely neglected. The findings improve our understanding of the complexity that move away from homogenization and create new challenges. The norm is not enough, as Ahmed notes. Reflection, evaluation, and agreement are required in order to advance in the study of university access, life, and progress for the entire university community with disabilities.